Post-traumatic stress disorder, or PTSD, is a combination of symptoms that's experienced after a traumatic event, and this can occur with childbirth. So some of the examples of traumatic childbirth experiences may be things that happen at the time of labor and delivery. So this might be an emergency C-section or forceps-assisted delivery, or it can occur really soon after delivery, so something like postpartum hemorrhage, where there's a significant amount of blood loss. It can also include traumatic events that affect the health of the baby or have the associated fear of death for your baby or for yourself. So there's really a variety of events that we can classify as birth trauma. All of these would increase the risk for PTSD in the postpartum period. And there are 4 different clusters of symptoms of PTSD that are all tied to the experience of the traumatic event. The first cluster of symptoms we think about are re-experiencing symptoms. So these are those intrusive images or thoughts that you might have about that traumatic experience, or the physiologic reactions that you have when thinking about the birth experience. The second cluster of symptoms are changes in the way that you think and the way that you feel after the birth trauma. So common examples would be feeling persistent anger or fear or self-blame. And if you start to notice these generalized thoughts that are tied to the experience, things like, I don't trust my body anymore. My body failed me. I don't trust medical providers. I don't feel safe in my own body. These general statements that you find are tied to that traumatic experience can be signs of PTSD. The third cluster of symptoms we think of as hyperarousal symptoms. So these can look similar to postnatal anxiety in that they can be include difficulty with relaxing, feeling restless, feeling jumpy or easily startled, and include physical tension in your body. And the final cluster of symptoms are what we call avoidance symptoms. So this is if you notice yourself avoiding any reminders of the traumatic experience. So for example, you might be avoiding talking about the birth experience and have a really difficult time when somebody wants to talk to you about how was your labor and delivery, and you find that that's actually really difficult and uncomfortable for you. It could be difficult to look at pictures from that experience or any other reminders. And this is especially difficult in the context of birth trauma because sometimes the baby or babies can serve as a reminder of the traumatic event themselves. And a lot of times I will hear women talk to me about feeling so sad that they didn't have that initial drive to hold their baby. When they talk about, like, when my baby came out, I didn't even want to hold them. I was so depressed, or I was so exhausted, or I was so confused and vulnerable that I didn't even want to hold my baby, and I feel terrible about that. I feel so guilty, or I feel so much grief over having that loss of this fantasy that I had been thinking about for years and thinking it was going to be this magical experience like a wedding day when really it was one of the scariest times of my life. It is very normal to experience grief in the context of childbirth, of the postpartum period, and to really recognize that as grief and a loss that you experienced, I think is very important. One thing to consider is that birth trauma or childbirth-related PTSD is probably more common than we think, and it's often misdiagnosed as depression. And so it's important to really consider your own experiences, own internal experiences. So if you notice, again, that it's very challenging, difficult to talk about, think about your birth experience, that's very, very important to consider, and speak with your provider when you notice any of those symptoms. So the good news is there's a variety of treatments available for postpartum PTSD or childbirth-related PTSD. So we have psychological treatments available. Most common evidence-based therapies that are recommended include cognitive processing therapy, prolonged exposure therapy, and EMDR, or eye movement desensitization reprocessing therapy. All of these are available treatments, and the good news, again, is that women have options. We also have a variety of medications that are available to treat postpartum PTSD or childbirth-related PTSD. As with any disorder in the postpartum period, it's important to consider breastfeeding status. So if you're breastfeeding, you really want to talk with your provider about potential side effects with any medication as it relates to breastfeeding.